Candida is the most common type of yeast infection found in our mouth, intestinal tract, and genitals, and it may affect your skin, nails, and other mucous membranes. But what are the symptoms of Candida overgrowth? You might have it and not even notice it. In today's video, I'll go over 10 symptoms of Candida overgrowth and how you can treat it. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to receive notifications and be the first one to watch a new video. If you need an online appointment or supplements for your disease, visit drlandivar.com. And I encourage you to stay till the end of this video where I'm going to reveal extra tips and video links related to this topic. When your body's natural pH balance is upset, Candida can outgrow out of control, creating a systemic problem and unpleasant symptoms. Candida overgrowth syndrome is a combination of signs and symptoms that show up when Candida has grown out of control. All right, so it's important to know what are the symptoms of a chronic health condition as this one. And people have experienced serious yeast infections can find themselves with sensitivities or allergies to intolerances of foods they never had before. But today we're going to go over 10 most common symptoms that indicate you have Candida overgrowth. Number 1, hormonal imbalances. All right, and Candida can produce hormonal imbalances that present itself in many other health conditions. And let's not forget that hormonal imbalances can raise havoc in our bodies. Okay, it's important to recognize how this infection can cause, for example, early menopause, premenstrual syndrome, low sex drive, migraines, endometriosis. Other ones are water retention, mood swings, our inability to lose weight, etc. And what happens is that with Candida overgrowth, your body becomes more inflamed, causing yeast to overgrow and spread beyond your digestive tract. And as a matter of fact, one of the byproducts of Candida can mimic estrogen, leading to a serious hormonal imbalance in people. Number 2, chronic fatigue. If you have fatigue or exhaustion that you simply cannot overcome regardless of the number of hours you sleep, you may have chronic fatigue syndrome. All right? This disease is characterized by fatigue that lasts for a minimum of 6 months and is often carried with other Candida symptoms, including, for example, headaches, sore throats, joint pains, or even difficulties in memory and concentration. One of Candida's symptoms is chronic fatigue, but it's obviously not the only cause of chronic fatigue syndrome. Number 3, mood swings. Okay, Candida can produce symptoms that are very common to other conditions. And one of the reasons it's so difficult to diagnose is exactly this. There are so many other conditions that bring about, for example, mood disorders, anxiety, mood swings, irritability, depression, and even panic attacks. And this is why I always recommend my patients to do a thorough correction of their general health before treating mood disorders. And most of the times we discover that one of the problems is Candida overgrowth. All right, number 4, nails and fungal infections. Okay, athlete's foot and fungus in your toenails are common yeast infections, and recurrent infections may be a sign that you have a systemic Candida infection. All right, Candidiasis of the nails can result in the following symptoms in your fingernails or toenails. For example, you may experience brittle, easily breakable or splitting nails, white or yellow discoloration, or your nails can be just crumbling apart. Be careful, because if you don't treat it, the affected nails may become thicker and more discolored. This condition is not usually painful, but in the long run, if infection progresses in your toenails, your toes will start to hurt. Number 5, intestinal distress. Persistent intestinal distress is one of the most common symptoms in candidiasis. For example, persistent flatulence, burping, bloating, constipation, or even diarrhea or stomach cramps are all symptoms. These may all be caused by a lack of bacteria in your digestive system, which lets Candida overgrow and create all these symptoms. So stay away from frequent antibiotic use, which is very important. When yeast overtakes the intestines, healthy bacteria are usually undertaken and cannot fight off the infection. Depending on the type of patient you are, you may experience dramatic relief in chronic intestinal distress when you treat yourself for a Candida infection. Number 6, sinus infections. All right, and sinus infections are becoming very common these days, and sometimes the exact cause can be very difficult to diagnose. Candida does affect the sinuses and can result in persistent cough, nasal dripping, and increasing congestion and allergies. If you experience consistent problems with your sinuses or allergic rhinitis, it's time to check and see if you don't have a Candida infection. Number 7, skin rashes. All right, Candidiasis can also set in the skin and can lead to redness, rash, scaling, or even swelling of the skin. These symptoms often happen in areas of the body where it's more difficult to keep it dry and in places where the skin touches other parts of your bodies. So some examples of these sensitive areas, for example, are skin folds under women's breasts, the groin, armpits, and spaces between fingers and toes, and even the foreskin of an uncircumcised penis. Okay, Candida infections tend to itch and feel uncomfortable, but treatment can relieve these symptoms. All right, number 8, brain fog. All right, and as I mentioned earlier, Candida can cause mood changes and chronic fatigue, but it's also important cause of brain fog, and many times is overlooked as a symptom. It's not uncommon that if you have a Candida overgrowth, you have poor memory, poor physical coordination, and difficulty concentrating for your tasks. Number 9, recurring vaginal and UTI infections. I have seen countless number of patients that suffer from recurrent infections in their urinary tract or vagina, and many times Candida is the root of the problem. It's important to realize that Candida can be sexually transmitted and sexual partners can spread it back and forth. For women, reduce the risk by avoiding tight-fitting underwear and avoid hot baths during an active infection. This will all help. Number 10, oral thrushes. Okay, just in case you weren't aware of this, an oral thrush is a yeast infection, okay, caused by the same strain of Candida that affects other mucous membranes like the vagina, for example, and it can be caused by the use of prednisone, antibiotics, or corticosteroids. All right, and if left untreated, it may spread throughout the body, including the digestive tract, lungs, liver, and even heart valves. And believe me, having Candida overgrowth in lungs and heart is no joke. Help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions or comments, feel free to leave them down below and I'll be happy to assist you. All right, if you need quality supplements for your disease, visit drlandevar.com. And right over here, I suggest you check out these other videos related to this topic. You will find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.